Westland, correct?
Correct.
Correct, okay.
Yes.
I know you spoke to our group many times before with when Ruth Ann was president, but I don't think I've met you. I think that last time I was supposed to come, but I think the weather or something was acting up, or I was having some fibro flare-ups, or I couldn't make it for some reason. I don't
Okay.
remember. No, I think I was sick that day, I think.
Hopefully not COVID.
No. This was way before COVID.
Yeah. Oh yeah. That's
Yeah, so far I've been pretty safe, knock on wood.
yeah. I got my vaccine Friday.
Great. I've been waiting. I'm in the group, but I can't, it seems like they haven't sent me email yet.
Yeah. You Wayne County?
Yes.
Yeah. They haven't started the above 65 group yet,
Right.
even though most other counties in Michigan have on
Right.
Monday. But I mean, we just got our office. The staff from our office just getting theirs today. I know other counties. My wife, they got theirs like a week and a half ago.
Wow. I know
Which-
there's some.
Which vaccine did you get, doctor? Do you know which one it was?
Moderna.
Oh, that would be good. Yeah,
Yeah.
I have to get that one.
Yeah, and then
Are so good.
my staff is staff is getting Pfizer today,
Oh.
and then and Johnson & Johnson has one.
Oh, I heard about that, yes.
Yeah, they were supposed to have something like 12 million vaccines sent by February 1st, and they might get 2 million.
Oh,
They're
wow.
having some problems in either production or something like that. So
Huh.
hopefully soon.
Yeah, I'm
The nice
ready.
the nice thing with the Johnson & Johnson one is it's one shot.
That would be nice.
Yeah, and the other two are two. Pfizer, you wait 3 weeks between your first and second, and Moderna, 4 weeks.
I wonder if the Johnson & Johnson one is stronger too.
I haven't heard that. I've heard they're all about 95%.
Mhm.
But with the first one with Moderna and Pfizer, you got about a 54% effectiveness. And after the second shot, you have 95%.
Oh, wow.
Whereas Johnson & Johnson, I think it's around 94, 95, which is the one.
Too bad.
But it's a
too bad
different,
Go ahead. Sorry.
yeah, it's a little different way of doing it.
Mhm. I would like to I wonder if there is a way you can request.
Yeah, you can request it. Just go to the county health department and find out when it's available. That's, you know,
Yeah.
I mean, I've heard of other places where it's first come, first serve.
Oh,
Yeah.
So they only have so many doses, so you have to wait in line. If they run out of doses, well, come back tomorrow. And all the other ones are appointments.
yeah, so I was gonna get one for my mom because she just turned 65 last August, but would she have to go through her doctor's office? Because I know we tried calling there, they don't have them in yet. That's what they
Yeah, the private practices don't have them yet.
Yeah.
Oh, okay. So I guess she would have to wait or make an appointment with
Yeah.
county department, you said?
Yeah, county health department is right now what they're doing in Michigan.
Oh, okay.
How do they decide what places do get it, like doctor's offices or hospitals? Who's making those decisions?
Oh, that's all political.
Hmm.
Uh-huh.
And what they did first, though, is they did first responders first, which was probably the best idea, and let them get it first. Then they went to other healthcare providers who are subject to it, and then the next one is seniors and others with multiple systems problems. And I think military can get it. Anybody military can get it now also.
They should be able to.
Yeah, some are doing, if they're doing like 65 and over, instead of doing 65 and over, they're doing 90 and plus for like a week, and then they're going to do 80 and plus, and then 70 and plus, and don't know what else. That's however they're doing it. Though where I was at, I had mine at 7 a.m, and they said they were doing 120 that day, even though they had room for 300. But one of the nurses that was there saying, oh, I have some friends that need it, their health care. And they said, well, you got to go through the portal to sign up and make an appointment. Really? You know, if you've got another, 280 spots,
No.
just let them come there, sign up, go through the portal and get it done. And they're not doing that.
Organized.
Yeah, the logistics are strange.
Right.
Do you have any reservations about any long-term side effects that some people say about?
Yeah, so far, no, nothing that I've heard of. And my wife's a nurse and she works with in a family practice, and he's on the board at St. Mary's for pharmacy, and he said there's just nothing long term. First of all, they don't know anything long term because we don't have any studies on it.
Right.
But you compare this to everything else, other vaccines that are out there, and there hasn't been a problem.
That's good.
Do some people have allergic reactions? Sure. Some people have allergic reactions to other medications too, and
Right.
other vaccines, but they're not getting they're actually, so far, it's been very low with any
Good
reactions.
to hear.
Somebody told me, I don't know if it's true, I haven't researched it because I am more of a researcher, but that they didn't do animal studies on these, which, I mean.
Yeah, that's what I think Johnson & Johnson did. I was reading something, but I'm not sure if the other ones did or not. But they're basing some of the research on other similar coronaviruses and mRNA vaccines.
Oh, huh, okay.
I think we got another member popping in now.
Okay.
Yay. I think it's Joy. Oh, there's more
excuse me.
people.
Yeah. Excuse me one moment.
All right, let's see.
Okay.
It says joining. I don't know if she's coming in or what. I'm still new to doing this, so bear with me. It says she's joining, but I don't see her in the room. So that's kind of weird.
Yes. With mine, it was just on my office laptop, but on all my other things, I have Zoom already installed, and that's what I forgot to do on this one. So it took me a little longer, but I'm here.
Oh, that's good. Yeah, I don't know why it says 6 people are in the room, but I don't see just us 4. So
Mm-hmm.
Wonder if one of them's like for the phone.
oh, wait a minute. Oh, I thought I saw. Oh, there she is.
Joy.
She finally popped in. Hi, Joy. I mean, she's still connected.
Yeah.
Yeah, we were going to do this in person at the church, but with the virus and everything going on,
Yeah.
not a lot of people are comfortable going. So we try to do it this way and see how it goes. So, right, Cheryl?
Yeah.
Plus, it's nice to see everyone's faces.
Yes, I wish we had more people, but this is just nice too. So,
Yeah, some a little bit later anyway, like even in person.
right. So,
Mhm.
do you think we should start reading the rules now, Cheryl? Or should I wait
Yeah.
till more people come in?
You can start.
Okay, so let me introduce myself. My name is Cindy Jovanovski. I'm the president of the Fibromyalgia Support Group, and Cheryl's my vice president. And I'm going to read the group rules to you. Nice to see you all. Should I read like the whole thing, Cheryl, or just the part where it says our goal? I was meaning
Our
to.
goal be good.
Okay, that's what I was going to ask you before, but I forgot. So, our goal, our group has shared many ideas and information with all of you. Some of you may have found interest in them, while others not, and that is okay. We think it is important to remind you what this group is about. We are a support group. We talk and share our thoughts and ideas. We have speakers each month and also have provided a second meeting on the 4th Thursday each month for you to share. Excuse me. We do not endorse any products. It's for information only. We feel that each of you can make your own decision on what we present. We do like to hear what is working for you. Maybe others will try what you are doing. We try and make the meetings as positive as possible. Remember, what works for you does not work for all, but it is our duty and goal to bring the information to the group. So you can decide from there. Now I'm going to introduce Cheryl, and she's going to introduce our speaker. Take it away.
Well, I don't have a whole lot to say, although I have seen Dr. Is it Hodak?
Right.
Dr. Hodak a few times at our in-person meetings, but he's always very interesting and always takes the time to answer our questions thoroughly. Doctor in Westland, correct, doctor?
Yes.
And I'm not exactly sure how many years you've been practicing and how if you have a lot of fibromyalgia patients, but I want to tell the group just a little bit about yourself. But I'm really happy that you're able to join us today and take the time out of your busy schedule to meet with us.
Well, thank you for inviting me. It's always a pleasure to talk to your group because there's always interesting and excellent questions that always come up too. Even make me think a lot and go over things. No, but I've been in practice about 40 years now. And my wife keeps saying, when are you going to retire? And I said, I don't have any plans on it soon. We do have more than a handful of fibromyalgia patients in our practice and dealing with what we do. But we're here, and it's great. I have another doctor, Dr. Michael Pack, who's here, who's excellent. And saying he's a whole lot smarter than I am, saying he's younger and better looking too. So he's been here. So we've got a lot of slots available and whatever. And we were down for 2 months last year, but we're back on track now. And hopefully in a couple more months, we're going to see people's faces after all the vaccines go through. But one of the things that, as far as talking about, asked me, one of the questions was what direct effect does fibromyalgia have with dry eye or anything with the eye? And again, we talked about that once a long time ago, but directly, there's nothing that fibromyalgia and dry eye are connected with, but it's all the medications is that you're taking. Almost all medications have some sort of effect, can have effect causing dry eye. And dry eye, the way we define it, it's not just you don't have enough tears and your eyes feel scratchy. There's a lot of people that have dry eye and are tearing a lot. We define dry eye by the base of the tear. So your eye constantly has to make tears to stay wet. When that base drops too low, that's when you start to get extra tearing coming in. And so that's when people get the burning. They come in and they say, my eyes water and burn all the time. And then we say, oh, you have dry eye. And they look at us like, you're not listening to me. How can they be watering and dry at the same time? Because what's the watering part is a backup system that's kicking in to try to build your base layer up. And I tell people it's kind of like saying, well, I have dry skin, so my skin's very oily. And that's not true because your skin does not have a backup. Your skin's dry, it's dry, that's it. Your eye gets dry. Then it has extra tearing that kicks in. And then that extra tearing kicks in, then we get the watering. So that's what we look at when we say that. And so that's why we tell people with dry eyes, we have them put tears in their eyes and think that, well, that doesn't make any sense. I'm saying all we're trying to do is build up that base layer of tear to go with it. I said, as far as the medications that cause it, it's just about every medication out there. You know, the blood pressure medications, pain medications, the antispasmodic, anything that's anticholinergic that's causing anything, a lot will cause dryness or reduce tearing or reduce oils. And when we talk about reduced oils, there's glands in your eyelid that produce water and oil. Now, the water keeps your eye wet, and the oil prevents it from evaporating too quick. And so either one of those could be low in creating dry eye. And if anybody's heard of something called Meibomian gland dysfunction, and the Meibomian glands are the oil glands in your eyelid for your tears. And there's a lot of people that have dry eye secondary to low oil, not low water.
Oh.
And now a lot of the oils, a lot of the artificial tears that are out there are oil-based tears to try to build up that oil layer. Okay, and while I'm going on, anybody has questions, just bring them right up so we can answer those right away.
I was going to say, doctor, what did you say about the dysfunction? We said Meibomian gland dysfunction, you said?
The Meibomian glands, those are the glands that secrete the oils for your tears.
Okay.
It was some Dr. Meibomian back in the 10th century threw his name on it. I looked him up. And so if his name was Smith, we would have called them Smith glands. But those are the oil glands for your tears to make sure that your tears do not evaporate too quick. Maybe I tell people it's like putting a bowl of water out on the counter and just letting it sit and it'll eventually evaporate.
Okay.
But if you pull a bowl of water out on the counter and put a little olive oil so it covers the surface, it's not going to evaporate as quick.
Okay.
I'm saying, so these are the oils for our tears.
Mhm.
And the drops that we're using, the new ones, there's one called Refresh Relieva.
Okay.
Is a newer drop out there that's very, very good. Another one, Cystine. Yep, is that the Relieva?
No, this is Blink Tears that I use. I don't know if you use this. Yeah.
Blink Tears is very good. There's kind of 4 of them that we've been using. It's Refresh Relieva. The Blink Tears is very good. Cystine Complete. And another one is called Soothe XP. And the XP means extra protection. And the XP happens to be the oiliest of them all. And I tell people that when you put that drop in your eye, you blink and go, wow, that's really soothing. And I'm going to smoke your room because it's a very thick oil and it looks like you're in a smoky room for about a minute, and that is normal. After about a minute, it goes away and your eyes feel pretty good with that one. But some people don't like that oiliness, so one of the other 3 are a little bit less oily. The companies, I want to apologize. I'd like to show you a sample just like what you did, but we have 0 samples. The companies give us samples in October, and then they come back in February. They're at their meetings and saying, otherwise, normally when I come, I call the reps up and we're able to get 2 dozen bottles of everything that we can, but we're completely out of samples now. But you can look those up. And most of the time,
They have me on cyclopentolate.
I'm sorry, I didn't hear that.
They have me on cyclopentolate.
Okay. And how is that working?
It's good. It's really good. But it's one more thing, one more medication in my shoebox.
It's just all the medications and saying, and then some of them, it's like people say, well, boy, that medication's caused my dryness in my eyes. Yeah, but it's helping you breathe. It's helping you stay alive, helping you feel better. We'll just use these. And I tell people what we have is artificial tears. We don't have real tears that we produce. And saying, so all the bottles are artificial. So the best tear for your eyes are your own tears that your eyes can make. And people say, how can we build that one up? Is that's the important thing. And I'm saying the number one thing that we find with that is hot compresses. So I tell people, if you take a shower, at the end of your shower, massage your eyelash line. If you massage the top of your eyelid, if you massage the bottom, it doesn't work. Those glands that secrete the tears are right along the lash line. So you have to wipe it. Now, you don't want to poke your eye out through your ear when you wipe, but you can't be really dainty, but just kind of wiping that, because after you've been in that shower in the warm, moist heat for a while, that thins the oils out. And when you massage it, it kind of squeezes them out. And that gets those tears flowing, the oils flowing. And that's the best thing. Other things besides a drop, we found out that Omega-3 fatty acids can help. Any fish oil, flaxseed oil, that can help because, and number one, omega-3s are just really a very, very good general anti-inflammatory for the body. And most of the problems with dry eyes can be secondary to inflammation, secondary to fibromyalgia, and anything else that goes on. So that's when we want to start to, let's use some, try to reduce inflammation in the body. And saying, so omega-3s can help. Well, the problem with omega-3, sometimes if you take too much, they're also a blood thinner. So if anybody's taking any blood thinners, before you start taking a lot of omega-3s, you can ask your physician about that and see if you're capable and available to take those omega-3s at all. And people say, well, you know, are they better to take a fish oil or a flaxseed oil, or, and saying it's whatever you take is better than nothing. But the fish oils, the animal-based fish or krill oil, have animal-based omega-3s, whereas flaxseed, grapeseed extract have plant-based. So when you take a plant-based omega-3 in, it's used about at the rate about 70%, whereas an animal-based one is used at like 95 to 100%. So when you take an animal or plant-based omega-3, you got to take a little bit more. Normally, we say about 1,000 milligrams of omega-3s per day.
Oh, okay.
It would be good to take. Sometimes also a B complex can help out. And saying those are the two that we, as far as nutritionals, that we look at for the dryness in the eyes. Otherwise, it's artificial tears and hot compresses.
Oh, doctor, what about baby shampoo? Like my eye doctor, they told me to use that sometimes too, like to under the eyelids and stuff. Does that work?
Excellent question. And I love that question. And whenever we're at seminars and you're listening to supposed experts talking about it, that they say, oh, use Johnson & Johnson's baby shampoo because it's no more tears. It actually should say just a couple less tears than the others. It shouldn't say no more tears. And I ask every doctor, have you ever used it? And the doctors go, no, I haven't. I said, try it. You'll never use it again. I mean, I used it once and I'll never use baby shampoo again. It burns. They have, and that's why I always say it's an excellent question. There are some soaps and cleaners for the eyelids. One is called OcuSoft, over the counter. They have different ones. There's regular, there's OcuSoft Plus, there's OcuSoft Allergies, and they're all very good. They come in, sometimes they come in little containers of like a foam, or they come in little pads that are like a little, I tell people it's like a Kentucky Fried Chicken wipe. You open this pad up and after a shower, you wipe your eyelids. And I said, the biggest thing with those pads is they're pretty big, you know, they're about this size, and say, you don't need it that big. You can cut them in quarters and just use a little bit of a quarter on it and wiping the lids. And that one does not sting, the OcuSoft. Systane also has some pads that clean. So I usually recommend those.
Okay.
And saying, try to stay away from the soaps.
I have a quick question.
Sure.
I'm on Zalatan for glaucoma. And I've noticed that I know one of the things that happens with some of the glaucoma drops is you get really long eyelashes.
Correct.
Well, my eyelashes on the right side seem to be really like curled up and brittle.
Mm-hmm.
Is there something I can do, like with the thing you were just recommending, help to soften it a little bit? It's almost like the right one is like really hard, my eyelashes.
Yeah.
That would help.
Okay. Yeah, and that's one of the things is some of the drops they do cause the eyelashes to grow thicker, darker, longer.
Right.
And saying that the only thing is to use the drops. When you put the drop in your eye, put a little bit on your eyelash line. And saying, but we don't have anything besides that.
Yeah, it's kind of strange. I've been using them for years, but It
Yeah.
just seems like the right side has been more brittle lately. I'm trying to, soften them up. I do use tears once in a while, but not, probably it's not as much as I should. And I try to drink water, and I need to drink more.
Yeah.
So,
And they used to say 8 glasses of water a day, and we're getting away from that and saying you need just liquid. If you don't need 8 glasses of water a day, that's not always necessary. If you had a cup of tea, a bottle of juice, that counts.
right.
And the liquid in the body does help.
Mm-hmm.
But as far as softening those lashes, it'd just be the same things as, they're growing.
Houdek?
Yeah. Oh, yes.
Yeah, we got another person. Hi, Bob.
Okay.
Hello.
How are you?
Hi. That's fine. How are you doing?
Oh, we're good. We're just talking to Dr. Houdek here.
Good.
Nice.
Yeah, so I know you guys popped in late, but that's okay.
That's
Okay,
right.
sorry.
Yeah,
Here,
your
you stay here.
meeting.
All right.
Okay,
I gotta go back to
We're
work
back
though.
now.
I was just helping around.
it's working from home.
Oh, okay.
All right, I'm up.
You want to put me on video or?
Yeah, I think fine. You can put me on.
Can you see her?
No,
Oh, I no, we just see the name, but we don't see
All
a
right.
picture.
Okay.
we're on the video.
All right. No, I can't get it to work. Oh well.
It's okay.
Sorry.
I can listen
Sorry.
though.
She can listen.
Oh,
Okay.
that's okay.
So, Doctor, I had a question for you.
Sure.
Something that they have not been able to figure out is I have nystagmus. So it goes left to right and up and down. And so the neurology specialist has not been able to figure out what that's connected to. Any ideas?
Oh boy, we get that, and I get people like that, and I can't figure it out. I refer them to neurology. It is tough. Now, sometimes with some people, we can put in a little bit of prism into the glasses, and sometimes that kind of settles it down a little bit. There is a prism called Fresnel, Fresnel, and we call it's a stick-on prism. It's kind of like a clear color form that you stick right over your lenses, and it can sometimes make you feel better, or it reduce your acuity. It makes it a little sharper, so your eyes are not bouncing as much. We've never been able to fully correct it, but that's a possibility, and we have all sorts. So you just go in the office, we put it on, and if it works, we cut it the same size of your lens, and you stick it on the back of your lenses and see if that helps. Sometimes a tint in the lens can sometimes help darkening up the lens a little bit, or with certain colors. But again, that's just a trial and error. And I tell people, I can use, I tried on one person, it works, and the next person, it's a new person, and things just different.
All right.
Do you think it is related to medications? Have you seen that as a side effect?
Nystagmus,
Yeah.
there have been with certain medications, but it's not a very common side effect of medications.
Okay. Okay.
Now,
Yeah,
can
double
you-
vision can be though.
Can you explain nystagmus to those that might not know what it is?
Sure. Nystagmus is where the eye just moves back and forth. Now and it doesn't stop. It just keeps moving back and forth. It can be up and down. It can be diagonal.
Oh.
And saying most of the time it's back and forth, but you can have any variant of that. And again, we try to do things. We work with the neurologists on it, trying to see what they can find, if they can pinpoint it at all. But what we do with lenses is try to add a little prism or try some tints to see if we can slow it down. When it gets too bad, or if the two eyes aren't working together, sometimes just patch one eye and it seems to be a little better. Now, Joy, with your nystagmus, is there any particular way, maybe you turn your head side, up or down, that you have less nystagmus?
No, unfortunately, and they've asked me that question before, and sometimes it'll last 20 minutes and sometimes it'll last 4 to 5 hours. And I'm on a nutritional supplement now that is really helping with all of my pain and everything. And so I have not had an issue with it since September, but occasionally I'll notice that it does come back, but it only will last like 5 to 10 minutes.
Oh.
But when it does come back, I literally have to hold on to the wall in order to walk to the bathroom because
Yeah.
it affects my balance.
Oh yeah, it's vertigo, and you're trying to, see something that's moving. I'd say take the
Right.
whole room and move it and see how comfortable, and it's very disturbing. And
Right,
saying,
but I went to Children's Eye Center.
Mhm.
They put me on a muscle eye twitching or a muscle drop, and it did absolutely nothing.
yeah,
And then I went to a neurology specialist. I went to the Mind Clinic, and that's my wonderful, wonderful neurologist, Dr. Pollock, and she couldn't figure it out.
yeah, that's why I tell some people, I say when they ask us some questions and we're saying, boy, we really don't. I just say, we're not always as smart as you think we are. We're still learning too. That's why we say we're in practice. We don't have it down pat yet. And saying, learning and saying, and just, try this, try that, try this. Let's see what we can do. And it's interesting. That's what I'm saying with tints or prisms sometimes, and saying we scratch our head and say, I don't understand why this works, but it's working. And we'll try that out. Did you try just looking with one eye or closing one eye and see
No,
if it doesn't?
that's something that, maybe that'll help, but at least, I've never, I'll have to ask about the prism. At least I'll have something to look towards because we had no answer.
Yeah.
So thank you.
Yeah. It's a punt.
Okay.
Right, exactly. That's the deal with fibromyalgia is we keep on looking for answers. So now we have one answer. So thank you.
Yeah. And that's, yeah, you're welcome. And that's what, we're learning all the time and saying, boy, this worked for that person. Maybe we can try it with somebody else and try this. And it's wonderful when you tell us about certain things that helped out, like with you taking a certain nutritional and that's working, saying, well, I'd like to know that nutritional, and saying, and talk to it. Cause the chiropractor I talked to, he works with a lot of fibromyalgia too. And we're always kind of going back and forth, and I'm asking about nutritionals because he's more up on that than I am. But
Yeah, it's
always
called
learning.
Reliv, RELIV, and it's loaded with tons of the B complex in there and omega, and as well as a lot of other things, and lunicin. And I don't know if you've ever heard of a lunicin, but and I did a lot of research, and like everybody in this group, we've tried everything over the years, and you name it, myofascial, massage and grapeseed extract and blah, blah, blah. And now that I've come across this, I've noticed a decrease in my pain and everything else. And you just keep searching for answers. And I don't even know how many doctors I've seen in Southeast Michigan, but I've never seen you.
Yeah, and there's doctors that say, boy, we got a fibromyalgia patient, and they like to refer you to one of their friends, and saying we got to think a little bit more. And the basic thing is just to sit down and think and talk with them, and find out what it is, and just try to go through what you can to understand it. And saying it's like you're probably understanding it a lot more than we do because you're feeling it, and you can express your feelings, and then we can try to figure out from there of what goes on.
Okay. I have a question too, whenever you're available.
Sure.
Okay.
Sure.
I have blepharitis.
Okay.
And so what I've been told to do is a daily, washcloth on the eyelids and baby shampoo diluted underneath the eyelid where the eyelid, the eyelash meets the eyelid and all that. And it's really requires a daily thing for me anyway. I have rosacea, and I said, oh, that goes along with the rosacea.
Right along with that.
So I wondered if you had any other recommendations other than that, or you talked about the shower, massaging in the shower, and I wasn't sure how long or how hard do you have to press, and can you elaborate on both things I'm mentioning, I guess?
Sure. And the reason I mentioned shower, because you're in there 5-10 minutes. It's hot. It's like hot water, and saying that's what we want, the hot compresses. And hey, it's a whole lot easier because you try to get a washcloth, you put it under hot water and you put it on your eye, and 20 seconds later it's cool again.
Yeah.
And so sometimes I'll tell people, well, heat up a bowl of water in the microwave, and pull it out, make sure you don't touch it too much. And when you can touch it with your wrist, it's not too hot. Then put your rag in it and hold it on your eye and just keep doing that for like 5 minutes. But in the shower, you're doing that and saying, you just let that water run. Like I said, you want to massage it. Not too hard, but you have to just kind of rub just gently. And when it's been on that warm, moist heat, it's not as irritating. So that's why I say do it in the shower, because you're already there. You already got the hot water there. Once a day. Some people like, hey, give me that little bowl of water, and I'll do that too. The blepharitis, the other thing is, they say diluted baby shampoo, and that's why I say not straight baby shampoo, but that's where that OcuSoft or the Systane soaps come in instead of the baby shampoo. Another thing, look to see if you can get tea tree oil. And anything with tea tree oil in it, that is great. Might sting a little bit if you get it in your eye, but you can, if you have that, if you just have tea tree oil, you can put that on the pad and help to wipe that. But tea tree oil helps to break down those that buildup from the oils, from your oils a little better. And then the gross thing, I tell everyone, there's actually kind of like little mites that live in your eyelashes in there. They're supposed to be there. Now, when they get too many, then we have problems. But if you don't have them, you'd have problems. Now, when they become overabundant, that's where the tea tree oil helps to cut them back down to their normal level. Under a microscope, you can see them, but it's actually even higher power than what the microscopes when we're looking at your eyes with. So I've never seen one, but we can see sometimes just the buildup from them when we have somebody with a really, really crusty eyelashes. That's a lot of times it's called Demodex, if you've heard of that before.
Yeah, for that.
I'm
Well,
sorry?
I have heard of that Dermadex, yes.
Yeah, and that's that
So-
little eyelid mites, but they're supposed to be there, but not a whole lot. But that's where the hot compresses, the scrubs, and if you can add a little tea tree oil to that, can help take care of that. But sometimes it's within the system, and you're always going to have a little thicker oil, but just gentle maintenance is usually the best.
Okay. So there's really no cure anyway. If you have it, you're going to have it, evidently.
Right. Now, sometimes we can prescribe some antibiotics and even antibiotic steroid combinations to try to bring it down a bit, and that'll help out a little bit. But you want that followed pretty closely though, because it's especially if we're going to use a steroid on that too to help bring it down.
Now, I've been told that it's a very common condition, and I honestly, I don't think I know I might know of one person that has it, that knows somebody that has it, one of those, but is it that common?
Oh, it's
Yeah, it is.
They're very common. I see it daily. The blepharitis, and blepharitis is just you can call it an infection in the eyelashes. But when you look under the microscope, you can see a little buildup right at the base of the lash, a little extra oil. And a lot of people said, I've had that for 25 years. It's always been that way, and saying, yeah, it's just a low grade little one infection, and saying that's just normal. We have people that come in and their eyelids are caked, and I tell them about it, and they go, oh yeah, it doesn't bother me. Because it's eyelashes, not in the oils for the tears. And it happens, you're going to love this. The Meibomian gland dysfunction is the oils for the tears. And that's going to affect you more than the oils for the lashes. And you're going to love this one. Happens to be more in more mature women for the Meibomian, and the lashes are more men. That's just what I see in saying it could be hormonal related, and that's why we see it in women, and again, going through menopause or postmenopausal or any other conditions, and saying there was a study done 10 years ago with 10 women with severe dry eye, and they put them on a testosterone cream on their eyelid nightly. 3 months later, 8 of the 10 were wearing contact lenses that could never wear contact lenses before because it cleared it up. And we've tried everything with the progesterone, estrogen, any combination, and that just hasn't worked. But trying to get this a drop like that or a cream like that approved is really, really kind of tough because you're working with those hormones, and they said it was just one study, and there's been a couple others out of Europe on that. And they're saying, yeah, it's working, but tough to get that approved. But the best thing is like those scrubs.
Well, I've read that if it gets out of control, it can really cause some eye issues.
Oh, it out of control. You can get ulcerations, and that can affect your quality of sight because it's going to get in your, not only in the eyelash line, but into your eye, and then that creates just more and more problems. And if not directly with the mite, but with their secretions that they put out, and it just changes your tear film, blurry vision, stinging, and that could be causing the dryness too.
Oh, wow. Okay, thank you.
Yeah.
Well, doctor, I had a quick question.
Sure.
When you're looking at the computer screen like most of the day or your phone, can that cause dry eye too, besides the medications you were talking about earlier?
Oh, excellent question again, and saying it sure does. And it's when you're looking at the screen, you tend to concentrate. When you concentrate, you stare, you're not blinking.
Right.
And not blinking, every time you blink, you replenish your tears. So when we're not blinking, it's drying up. And I tell people all the time, I said, it was eye doctors that invented the computers because it's just wonderful for business. And saying it's just that blinking rate. They've come up with one of the things when you're looking at computers, they've come up with this thing called if anybody heard of this, a 20-20-20 rule. And the first time I read about this, I read it and I go, I really don't agree with this. And I'm really not sure why they did this. I don't really think this is really saying, because it's what you're supposed to do is when you're on the computers, every 20 minutes, take a 20-second break and look at something 20 feet away. And I'm thinking, are they kidding? Every 20 minutes? You're going to set your alarm clock every 20 minutes. I could be on my laptop for 2 hours and think I was on for 20 minutes. Yeah. And saying, so it didn't seem practical. And then I kind of calmed down and I said, okay, here's what we mean is people know 20/20. When you say 20/20, people know 20/20 vision. You think the eyes. So they just do the extra 20 on it to get you thinking about your eyes. So every now and then, take a little break, look at something beyond 20 feet. I say, even just closing your eyes and thinking about like looking over a lake or looking at a mountain or something, just to get the brain and everything to relax. Closing your eyes, re-wet some right there. So that's what they did with the 20-20-20 rule, and I'm saying the computers, it's just drying up. And then some of that, and with anything with the two with blue light, and saying so in lenses now, almost we're recommending everyone get some blue light blockers. And it's interesting, even that is a little controversial, is that some of the studies out there, and the way they do studies is let's measure exactly how much it's changing. And in those measurements, when they're doing the blue light and they're putting the blue light filters on, they're saying it's good, but it's not extremely significant. And so they said, well, it's still out whether really it's going to help. The other parts of the studies are giving like 100 people glasses. Half of them have blue light block, the other don't. And then have them use them for a month and then ask them how they feel. And most of the time, most of the people that wore the blue light blockers said they felt better and saying, hey, I'll accept that. And the people didn't know which ones they were. And the people that didn't have the blue light blockers, there was a higher percentage of those that said they really didn't make any difference. And so I said, hey, put the blue light blocker in, and it does help out. We know it's there. Let's block it. Let's make you feel better.
Oh, I had another question, and
Sure.
you were saying about closing your eyes, that helps moisturize it too, you said?
Yes, just keeping them closed because they're not going to evaporate.
Okay, and then
Yeah, go ahead.
Go ahead. I heard too that I've been told that like hard blinks, if you do a couple hard blinks, that opens the glands and moisturizes or whatever.
Yeah, that can. And way back when I was a little kid learning all this, they used to talk to us about, giving blinking exercises where you You know, blink your eyes, you know, keep blinking your eyes for like a minute, you know, a couple times a day, and thought about that and did that and saying, you know, really that doesn't work very well. But a hard blink just kind of squeezes those glands a little bit. And what we're doing, that could help them out a little bit, but it's not going to make a whole lot of difference. More of the inside corner here of the eye is where the tears drain. And saying sometimes a massage on that to get whatever tear there is draining out is good. With severe dry eye, we'll even plug up those openings.
Yeah.
And you plug them up and saying, let the tears, whatever tear you make, stay there. And if you're not making enough, if it's due to the amount of tear, then build up, let's keep the tears in there. And that's where some of the prescription medications, if you've heard of Restasis or
Yes.
Zydra or the new one, Sequa, those all are there to try to help build up the base layer of the water layer part of the tear. But we found out that probably 80% of the dry eyes is not due to a lack of water, it's due to a problem with the oils
Mm.
and that Meibomian gland dysfunction.
Yeah, that's interesting. You also mentioned about taking B complex, and that's the first I have heard of that in relationship to that. How is that helping the eye, or can you get into that description?
Yeah, the B complex and taking the beads and just the bees in general, as far as they're not the strongest antioxidant, but actually the B complex, that was before omega-3s when that's what we were told a long time ago and saying, but it helps with the oil part of the tear.
Oh,
And saying that's taking the B complex and that's saying, so when we're going back and saying, use the B complex and I'd love to break that down, but I apologize, I don't have that information in front of me, whether it's, should it be, thiamine or niacin, which one? But they said just take the B complex, the 369.
Yeah, no, I take a B50 every
Okay.
day. Yeah, once or twice a day, actually. But I didn't know the relationship, of what you just, I didn't
Right.
know that valuable information that you just said about that,
Yeah,
being related to the oil part of the tear. I was just taking it anyway, so
Okay.
that's good information. Thanks.
You're
Yeah, I
welcome.
had LASIK done like probably 18 years ago, and it caused quite a bit of dry eye. And also at night, I can't see as well. And like in a dark room, I have to squint. I don't see as well. But they plugged up my tear ducts
Yeah.
to
Oh.
help correct it. So
Yeah,
yeah, they actually took like a little cautery thing. And they
okay.
actually put plugs in to begin and out. So they actually, but I don't
Yeah.
know. I probably should use the drops more, but I don't think
Yeah.
about
It's I agree with you with using the drops more, and I tell people I'd rather take one pill a day than try to put 4 drops in my eyes a day. It's just easy. Take a pill, drink water, and you're all done. You don't got to put a drop in your eye. You got to get it in there, and
right.
it's going. It's not as easy to take. Now they do have some. There's a little device called Lacrocert, and it's a little silicone blob that you put inside the lid that goes. We've used it. We've had very limited success with it in the past, but they're working more on that, not only for just dry eye, but even for like some of the glaucoma medications and antibiotics. But nothing, they've been working on that for 5-6 years now, and we don't have anything else besides that. And I have one patient using that was available that Lacrocert is helping on.
So the
And
glaucoma drops cause dry eye too?
yeah, and
Yes.
some of that is secondary to the preservative in the drop.
Uh,
And the preservatives that they use, and they have to have preservatives in there. And most of the preservative that they use is called benzalkonium chloride. And it's abbreviated on bottles as BAK. And the reason they use it is that it is dirt cheap.
huh.
It's like pennies to the barrel to make. And it's wonderful. It'll keep the drop preserved for a long time. It's really cheap, but prolonged use can cause dryness, which doesn't seem to make any common sense. It makes dollars and cents. So I tell people if you're using an artificial tear and it has benzocaine and chloride or BAK, it means buy another kind. And saying get something without the BAK. And they also have the non-preserved drops and the little individual vials. And those are pretty good too, but they're a little more expensive. So that's why I say, like, you buy a bottle of Visine, it's this big for $10, or you buy something that we recommend for this big for $15. And people say, well, why should I spend more and get less? And say, because it doesn't have BAK in it and it feels better. And they say, yeah, it does. And I say, plus you don't have to use it as often. Because if they're using the other drops and they're saying, yeah, I use these Visine drops 6-7 times a day and they don't work. And I go, I agree. Yeah, I agree. But use this drop 2 or 3 times and it'll work.
Have you ever heard of keeping eye drops in the fridge?
Yes, and excellent question again. And I recommend that a lot. I tell them, put it in a little Ziploc bag in the door of your refrigerator.
Right.
Because the door is a little bit warmer than inside. You don't want to put it in too cold. But you put a little Ziploc bag just to make sure it doesn't get contaminated. But when a drop goes in your eye cold, that feels really good.
Right.
And it's just as effective. There's no difference in the effectiveness if it's warmer or cooler.
I have another quick question about, we talked in the beginning about shots and stuff. Is there something that some people get with eye related with COVID, like red eyes, or I heard something that,
Yeah.
Eye or something.
Yeah, with COVID's a virus, and you can get viral conjunctivitis, viral pink eye.
okay,
Okay, so it's a virus, and with any virus, you can get a pink eye, which is be red eyes, watery. If it's a viral, red and watery are the main things. Maybe a little bit of swelling, and we look at that. And when people come in, and I've had a few people the last few months come in, and I'm looking, I go, oh, is this an allergy? Is this a cold virus, or is this COVID virus? And tell them, hey, if you get this, if it's lasting a little bit longer, take the one thing again, when we get the virus in the eye, it's a virus, and you just kind of let it out. And I say the best thing is just rinse those eyes, keep them clean. We don't have any a good antiviral for those. We do have an antiviral for herpes infections that we will sometimes get if we think it's a virus. This drop could possibly help out a little bit, but we don't use it too often. And the one thing I've had people say, well, you can catch, COVID through your eyes. And I said, calm down, and saying you can get pink eye, but if you're looking at somebody and they're looking at you, you're not going to catch it through their eyes. They've got to touch you touch it and go back in. It's just not going to travel in the air across. Doing that and saying, because it's like any other virus that way. But you can, if someone coughs on you in your face and you get a little bit in your eye and saying, yes, that can create it, doing that. But most of the problems are going to be with regular COVID. It's going to be the breathing issues, loss of taste, loss of smell, coughing, and it's deep cough down in the chest, not from the throat.
Can you talk a little bit about retinal migraines?
Yeah, retinal migraines are fun little things. I've had them since I was about 10 years old. And retinal migraine is what it is you get spots, colors, blank spots in your vision.
Yeah.
They can last anywhere from 5 to 20 minutes. And people say, well, I'm not sure if it's a right eye or left eye, and saying that's true because it's probably not in the eye, it's in the brain. And it's just expressing itself either to the up, down, right, left, and saying if you might feel like you're having it more in one eye than the other and how you see it. It's almost like a flash of light sometimes that you're getting, or sparkles of little light, and saying, but anytime we have somebody that says they have little sparkles or crazy things in the vision, we got to get you in right away, because besides a retinal migraine, a vitriol or a retinal detachment can create the exact same symptoms. And so we said, come on in and take a look at that. But the retinal migraine, normally if it's a tear or break, it kind of comes and goes a little bit, but the retinal migraine kind of lasts for that. I said it's that 5 to 15 minutes and then kind of goes away. And then you get a very, very light little headache. Some people can get really bad headaches. Some people don't get anything at all. You just take a look and saying, I've had mine when I've done a visual field and, it comes out, yeah, I know exactly the area it goes. And I get them 3 or 4 times a year. Don't know why all the time.
Right.
There's a lot of different things that can trigger them. I've had smells, trying to stain a cabinet.
Yeah.
And the best thing is I didn't have to do it. I had to give it to my wife because it's triggered 2 days in a row, triggered a migraine. I said, if you want that color, you got to stain it. So I got out doing that work. I've had flashes of light. People say strange stress. I've been on vacation twice, sitting, just relaxing, and all of a sudden a migraine comes up and going, where does that come from? Luckily for me, I no longer get too many headaches. It's just the migraine part. I've had scans, and people say just when you get them, it's just, let's try to figure out what your trigger is. What have you done the last 20 minutes, hour, the last day? Foods, anything you've eaten.
Yeah.
There's certain foods that can do that. That's kind of controversial. Again, it's getting back in the literature and they're saying that. And I said, no, I noticed that and especially if I'm fatigued or tired and I haven't eaten, that can create it. But
Notice when I'm driving and let's say sunshine hits the chrome on the car and it
Yeah.
into my eyes, it just all of a sudden I have to pull over or sit in the parking lot for 20 minutes. 20 minutes seems for me it goes away. But mine looks like a lightning bolt.
lightning bolts, yes.
Yeah.
I had one once. It was really, really nice. It was like if you took like 20 straws and you put them together to make this big box, and the thing slowly rotated, and all the straws were changing colors, and it was kind of floating out in front of me. I'm looking at him going, this is like maybe you're taking drugs or something. I said, this is kind of cool. And my wife goes, I was saying to my wife goes, you better take your medications. I go, not until this is over. This is really kind of neat. Because I wasn't having anything else. I was just looking, and then it went away, and I'm going, wow, that was kind of, I've never seen that one before. But it was again,
If there was no headache along with it, that would be really cool.
yeah.
Yeah.
I said, luckily I didn't get the headache, but as soon as those go away, I take my pills and say, nope, knock it down. And saying in what I do is that right now, luckily for me, I can now take like an Excedrin migraine and drink it down with a cup of coffee, get me some caffeine,
Right.
and that can help out to reduce that. So caffeine in high doses can sometimes take it away. Caffeine in low doses can sometimes create them, which is the strange thing with caffeine. But that's what, if you look at Excedrin migraine or Tylenol migraine, it has caffeine in it.
Doctor, go ahead. Sorry, you can go first.
I had a question.
Another question. Oh, sorry, go ahead.
I was on the Zoom recently, and one of the people on it mentioned something. They just happened to ask about an eye test that shows people who could get dementia or have dementia or are candidates for it or something. And I thought that was interesting. And I wondered if you knew about that or have heard of it.
Yeah, that came out a couple of years ago. And man, I think there was some research done in Australia that's from, it was an article. And what we're looking at is there's certain changes in the blood vessels in your brain with dementia, and they're noticing certain buildup. Well, the back of your eye, your retina, is actually brain tissue. And the vessels are there, they're related, it's all related to the brain. So if you tend to see any changes in these vessels in the retina, you'll notice also going on in your brain, which can lead to dementia. The testing is still in development. It's not there yet that we can use in practice at all. And I tell people, I look at how many retinas I've seen, and I've never seen any of that before. And then I've talked to my retinal specialists, and they said, yeah, no, you need special equipment for that to do that, but we do not have it here yet. But it's one of the things that they're looking into and saying it's fantastic, because and that's why we look in the eyes with anybody that's diabetic, anything going on, and saying we can see changes in those vessels. We don't have to stick anything in you or open you up. We can just look at them and see what's going on. And saying, so hopefully in the future, hopefully not too far future, because it was just a few years ago when they were saying they were noticing this, but they got to make it, actually economically available too, saying, yeah, come on in, we'll give you this $50,000 test and see if you're going to get dementia at all. You have to have something that can work, and we're more reliable on it too.
Okay, thank you.
Doctor, I was just going to ask you briefly, could you talk about floaters, like what causes them, and is it genetic? And like, say, for example, I've been getting floaters for a long time, and my mom just recently got floaters, but hers isn't so bad. Mine, I just see them almost all the time. So
Yeah, the floaters as in general are normal. The inside part of your eye is hollow, but it's not hollow air. It's hollow gel. And I tell people the gel is like a kind of a liquidy jello that's in there. And it does pass nutrients through this gel. And that's so light can pass through so you can get to your retina. But sometimes things just kind of precipitate out and it kind of floats in this gel. Now, people will notice these floaters more when you're looking at a white wall of blue sky while reading, where you're looking towards the light. And it's like you look at it and you try to catch it and you see it and you kind of catch it and it moves and it keeps moving with you because as you try to catch it, it's in your eye. So it's moving right with you. And then you stop and it kind of floats back. And then you try to catch it again. And it floats away and doing that. Now, those are normal. You have those all the way down to, I think I had them when I was in my, early teens. I noticed them. I'm saying they're normal if you're saying when you're looking at a white wall, blue sky while reading. Now, there's other floaters is secondary to either a retinal detachment or the vitreous detaches. Now, that gel in your eye is attached near the front behind the color part. So it's got this really big attachment area. And in the back along the nerve. And the nerve is very, very small. So inside your eye, there's only 2 attachments for the gel. Really big, really small. What happens is as we become more mature, that gel liquefies, so you can notice the other floaters a little bit more. And that's like when you're shaking those little snow globes up. Not only does it liquefy, it shrinks. Now, it's not just shrinking like this, it's shrinking like this too. So you got this big attachment and it's shrinking. So the attachments there are just going to pull it closer. Well, you got a little attachment in the back and it's going to pull it that way. But you got a tug of war, he's going to lose. So it's going to pop off the back. So then we get what we call a posterior vitreous detachment. So the vitreous does come off. And where the vitreous used to be attached is kind of like a little scar on the back of the gel. And when the light hits it, it casts a shadow on your eye, which is just like a floater. Okay. So I tell people, if you notice, people say, well, I have some floaters in my eye, and I have this flashing light over here, kind of like having a retinal migraine. But I also got this little spot in my vision. Now, normal floaters, they float away. With this, it's kind of like, no matter where I look, it's kind of always right in this area. I want to see that. And they say, when? I said, no. Okay, if you call me at home, it's Sunday afternoon, I'll meet you at the office because we want to make sure that that's all it is. Because if that pops off, that's normal. By the time we're 80, 100% of the people living on the planet and those in the space station have had that happen. Okay, it's a normal thing. 90% of the time, no problems. 10% of the time, I said it's attached in the back and the front. The back comes off. The front can come off a little bit too. Well, that's a little more attached to the retina. And if it's attached to the retina, it's coming off. It can pull the retina, and that creates a retinal tear or could lead to a retinal detachment. We don't like either one of those.
right.
And so when you come in, when you say you have a floater or a flash, you come in and we put drops in to make your pupil huge so we can look in the back just to make sure we don't see anything. And it's about 10% of the time. But if it's a little tear, we get you right out to the retinal specialist and they do a little laser right around it, kind of like a little weld, and just put it right back on. And that's what we want to do. And I tell people, don't wait. We've had people come in, well, last week, I noticed it. So now my vision's a little funny over here. And I say, no, now we went from a tear to a detachment. And so we want to take a tear. It's a stitch in time saves 9. And saying you get a detachment, it's not very visually comfortable. And saying there's a lot more surgery involved in it. but the normal little floaters that I just noticed that kind of goes away. But if you get any flashing lights with it, it's in one spot, then you're saying, you come on in. Let's make sure it's just a vitreal separation, not leading to a detachment or a tear.
Is a detachment, is there any, let's see, like if somebody in your family had a retinal detachment, is there more of a chance of you getting one? Or is it just, because my brother had one where
Yeah.
he said it was like somebody pulled the curtain down and
Right.
he had to go
Yeah.
in and get is it hereditary? What I'm saying.
It can be. It all depends on what caused the detachment. But if it's like nearsighted people are a little more prone to it because our eyes tend to be a little bit longer. So the eye's longer, the retina's on the back. The retina doesn't grow with it. It just stretches. And it can only stretch so far. So nearsighted people, if something comes off, they can tear that a little bit more. And it is when you get a detachment, it's unplugging the light and saying it's just like you said, it's a curtain coming down. You just unplugged it. It's gone. Shut the light off, and you don't see anything. So you'll see that and say, "Now I got that. I want to see that ASAP, and we're going to get you to the retinal specialist as soon as we can to try to repair that."
After I've been on the phone and computer a long time, I'll go to sleep. When I'm trying to go to sleep, it's almost like my vision is still seeing lights. I don't know if it's the blue light that's causing that, but it's like almost like swimming when I'm trying to when I close my eyes to go to sleep. It's like, I don't know if it's because of because when you look at a computer screen, there's all kinds of things moving on it.
Right.
Is that what causes it?
Yeah, and that can be because it's the retina still was stimulated, and it's got to recover itself. That's like a bright light flash in your eye, and you got to take time to recover. But one of the things too is when you're on the computer, you're sitting like this, and when you're sleeping, your head's down. So if you've had that gel liquefy, or if it's off a little bit, now it's shifted, and that's just like you take that little snow globe and you move it around so things can move around a little bit more. It takes a little more time to settle down. It's not as the snow globes are watery. Ours is more of a gel, so it takes a little more time for that just to settle down a little bit. But it could be a little combination of both things, but that's normal.
Is it also normal for some people to, when my eyes are dilated, it seems like it takes 6-7 hours to get my vision back to where it was. I'm talking about when they dilate to look in my eyes.
Right.
It takes forever, it seems like, for it to go down.
Yeah.
Is that common in some people?
Yeah. Some people just a little more sensitive to that. It also depends on the color of your eye. Now, blue-eyed people tend to, it affects them a little bit more than brown-eyed because with blue, there's less pigment in the eye, in the color part. So there's more drop hitting the muscle, so it can stay a little longer. Dark brown eyes, there's more pigment there, so the drop can get absorbed by the pigment and it never hits the muscle, so they don't have as much of a problem. There's also about 3 or 4 different drops that we use to dilate the eyes. It all depends on which one the doctor's using and why they're doing it. Now, if you're doing surgery, you're doing a procedure, you want to check that peripheral retina, you're going to get the drops that are going to keep you dilated for days. When you come in and we're looking just to get a good look out there to see what we can see, we can use a milder drop that wears off a lot quicker.
So I can mention it to whoever's doing the dilation that, hey, it lasted 8 hours last time.
Yeah. There's sometimes I'll say, no, they'll agree with you and say, yep, but that's what we use.
Okay.
And saying, because of what we want to do. Okay, we want to look out there. We've got to get the pupils open really big, and you got a brown eye, so we have to use this drop. So because it's going to take, I get some blue-eyed people, I put one drop in, and we normally make you wait at least 20 minutes. It takes about 20 minutes to cook to 30.
Right.
But I've looked at these people after 10 minutes, and their pupils, it's black. And I say, whoa, we got 10 minutes and we can look all the way out there. There's no problems. Right. And then they come down a lot quicker too.
What are you looking for when after they dilate, they put that really, really bright light? looking for when you do that?
Yeah, with the bright light is so that it's basically, think of it like looking into a completely black room, and you want to see what it is, and you're taking a flashlight and you walk in the room and you're shining that flashlight around, and we're looking at the entire back of your retina. We're looking for any changes, any of the, I call them spots, dots, lumps, bumps, holes, breaks, tears in the tissue. We're looking at those vessels, arteries, and veins. We're looking for blood sugar. We're looking for blood pressure. Any changes that way at all? You look at the nerve, you can see the nerve a lot easier. And when they put the bright light on a headset or whatever, we can get it in stereo. So we can look at the nerve, we can look for thyroid or MS, little changes to look at, saying, because it's all just showing up in there. I mean, people say, well, you know, my brother had a brain tumor and they diagnosed it through his eye, and saying, because they looked in his eye saying you have a brain tumor, and saying, because the nerve in the back of your eye, that when we look at that is one of the 12 major nerves coming off your brain. And I tell people, think of it like a paper towel tube that's filled up with Play-Doh, and push down on the paper towel tube, and the Play-Doh is going to go out the ends. So we're looking at one end. So if anything's pushing on that tube, on that nerve, we can see what the end looks like. And if it doesn't look the way it's supposed to look, we're sending you out to see a neurologist, and saying, you take a look inside. We're doing other testing.
What do you see in high blood pressure?
With high blood pressure, the arteries in veins, they're supposed to be in younger people, they're about the same size, but as we become more mature, those arteries tend to narrow down, or they'll hot dog. Instead of being a nice flow, it looks like you got these little hot dog, or you see the vessels are just tiny, they're just narrow. So they're not transferring the blood like they should be. And we'll say, yeah, certain little, sometimes the vessels will break with blood pressure. That little break looks like one thing. If it's blood sugar, it looks a little different. But we'll tell people to come in, and I'll look at them and say, my vision's off, and I'll look inside and say, yeah, that's because you're diabetic. And they go, well, how do you know? And I say, I can see it in the vessels. Go get tested. And, we're not going to do anything with your eyes until you get that sugar under control. Because the sugar can make the vision just wobble day to day. We had some people that come in and say, I look through my bifocals now to see distance. And yesterday I was looking through the top and saying that's sugar.
Wow. I didn't realize you could see that many things in the eye,
Yeah.
Well, that's just why I can see what you're trying to think about.
Oh, geez. Don't do that.
Yeah, that's why it's always, when anybody with diabetes, they say, get your eyes checked. You got to have a yearly check to see what's going on. And I mean, the retinal specialists we have in Southeast Michigan, it's just incredible the number of retinal specialists we have, and they are all packed. We have one practice with 16 doctors in it, another one with 8. And that's not even including Kresge Eye Institute or Kellogg Eye Center. And there's another couple of practices, and they're busy all the time, not only with diabetic problems, but with macular degeneration too. And saying it's insane, and a lot busier with that, especially if it's wet macular degeneration. I just had a friend of mine, and they do these injections in your eye to try to prevent the wetness from happening. He's had 86 injections over the last 6 years.
I know they have isn't there a laser for glaucoma?
Yeah, there is laser, and that laser's on the front part of the eye. And what they're doing, glaucoma is an increase in, it's simple as increase in pressure inside the eye. Now, when the pressure builds up on the inside of the eye, your eye's pretty tough inside. But I tell people your optic nerve in the back, like I said, it's like Play-Doh. So take a can of Play-Doh, and that you have a bunch of straws in that you want to blow through these straws. But these straws are in the Play-Doh. Now push your hand into the Play-Doh, and what you're doing is you're pushing all that Play-Doh to the side, and it's pushing on all the straws. So now all of a sudden you're not getting as much flow. Well, those straws are the blood vessels. So if you don't get flow of the blood through to get to your retina, that means it's not getting its nutrients, and that tissue dies. So that's when we look at to say we want to lower the pressure inside the eye. So fluid is made in the eye near the front, and it goes out the back to bring nutrients there. And that's the front part. That's not the vitreous. It's the anterior part more. And if you're getting not as much going out as going in, pressure builds, that's causing the problem. So what they use the laser for is to open up the angle, we call it the angle, or these little meshwork, it's like a little sponge. Blow them open, get some big holes in there and let all that fluid out.
Hmm.
Oh, I have a question, doctor. Speaking of procedures, there's some kind of machine, and I don't know what it's called, but it's to treat the gland dysfunction. And it goes along the lid and it warms it and massages it or something.
Right.
I don't think too many people have it. It is around, but I guess it's not very common. And I just wondered what you thought about that, or if you recommend it, or.
Oh yeah, no, it's called Lipiflow.
Yeah, that's it. Yeah.
And there's not many people that have it. I know of actually 2 people in Southeast Michigan that have it. When we try to treat the dry eye and meibomian gland dysfunction, I can only go so far. Then I refer to them because it's not a cheap machine. It's a little expensive. So we let the people that want to specialize with that. It kind of sounds archaic, but again, they're oil glands in your lids that are the oils coming out thick or not flowing. And saying, how do you get thick oil thin? You heat it up. That's why we use hot compresses. But if that's not doing it, the oils, if this is the front part of your eye, those oil glands are more back here. So we're trying to heat this part up when the gland's farther back here. So what this thing does is it wraps around the gland, and the back part heats up to 108 degrees. And then the front part is a big pressure thing. So it heats it up for 5 minutes, melts the oils, and then it presses them down to squeeze all that thick oil out. I think each one takes about 10 to 15 minutes. It's around $500 to $700 per eye. You do both eyes at the same time. It is not covered by insurance at all. But what they're saying is that it can last anywhere from 6 months to a year, one treatment. And saying if it opens up those glands and gets them going, that, hey, it's worth it because I don't have to use drops 20 times a day to try to build up my oils. There's a doctor in Plymouth, Michigan that has it. We refer to him for it. There's a doctor, I think in Troy she's at, that has it. I do not think like even Kellogg Eye Center or Kresge Eye Center have it. But we refer to those centers because I don't think they believe in it, but it does work. We've had people that have had it, and we've only had 2 people that have had to have it done twice within a month because the first one didn't take. But the Lipiflow is, and that's the purpose of it. Melt the oils, squeeze them out. They also have another one. It's a little probe. You have around 28 little glands in your bottom lid and about 32, 33 in the top lid. And this is a probe that goes into each gland and tries to open it up that way. I don't know of anybody in the state that has that. It's really careful. You don't want to break a gland when you're doing it. So we'd say I'd rather heat your glands up and doing it that way.
Is that Lipiflow safe? Because I think I've read about it because I didn't remember the name, but I read that it could cause scarring somehow, like of the eye or something eventually.
Depends. Well, as long as it's just 108 degrees, it shouldn't cause any problems like that. But you just have to. That's all I've heard. I've not heard of anything that any of the doctors have said there's any problems with it at all. What they tried, they talk about the scarring because if they don't put it on right, you don't want to heat the eye up. You want to heat the eyelid up. So if you add it in the back, then it has the heater. Then your eyelid goes up against that, so it protects your eye from heating up. So if there's a problem with that, if there was a problem with that, I guess it could cause a burn on your eye, of which hopefully they're doing it properly.
Right, but you would recommend it then? I mean, it would be.
Yeah, if the other methods aren't working, go right ahead with it.
Oh, okay, super. Thanks.
Yeah. Any other questions?
Well, I had one actually. It's kind of like a dumb question, but I notice like when my eyes get really dry and stuff, like when I would start crying or something, just like missing my father and my other loved ones in heaven and stuff. When I cry, I notice that the my eyes don't get as dry as when I'm crying, but when I don't cry as often, it gets really dry. Is that a myth or just part of the whole dry eye routine? I don't know how to explain it, but
No, it's part of that dry eye routine, but when you cry, those tears, that's that extra tear coming in. What's really interesting, if you cry due to emotional pain,
Mhm.
or if you cry due to physical pain, or cry due because you're laughing too hard,
yeah.
chemically, those tears are all different.
Oh, okay.
But it seems like it's coming from the same gland, and we're not. That's why we're still. I mean, dry eye is huge, and we're understanding a little bit more. That's why we have better and better drops. Back when I was a little kid learning this, we have 1 or 2 drops, and now there's just umpteen. We have prescription drops, so we do different things. But you're crying, so that tear is coming out and wetting the eye more. And saying some people, when we put them on drops, they actually say, "Well, these drops burn." Now they're not supposed to burn, but it's just like having a little cut and putting water on it. And you have a cut and put water on it, and that even burns. And that's because the burning sensation is because it is so dry that when you put something on it, you're feeling it. And until we can get that built up to back to normal, it's still going to sting a little bit. And then after a while, the drops go in and you don't even feel them.
Oh.
But yeah, that crying makes some thing. And to find out if your nose is working, your tears drain in the side, that drains to your nose drains to your throat. And so when women cry, they blow their nose. Men don't cry. We have allergies, but it's sometimes we get a little something in our eye. But there are tests actually. There's called a Jones test. We put a drop dye in your eye, have you blow your nose, and if it comes, we see the dye in there. We know that the opening is patent. If you blow your nose and there's nothing coming out, then we say, hey, you got a plugged duct.
Oh no.
Oh.
Sounds a little strange, but that's how it works. And there are some medications, eye drops, people taste and saying, yep, that means that's good because that means that duct is open. One of them for dry eye is Zydra, and it has a very metallic, minerally taste if you put it in your eye. And I've had 2 women that we put them on the drop, and it was great. They came in a month later and said, this is the best drop I've ever used. My eyes feel excellent, and I'll never use it again. And I go, but if it's working, they go, but I don't like the taste. And I'm saying, well, try to suck on a mint or, put the drop in your eye, hold it there for a little while. If you want the drop to stay, put the drop in, keep your eye closed, make sure the ducts are closed. You hold it like this for a couple of minutes and then let it slowly kind of seep down. But it sometimes let's put up the taste, but it'll eventually kind of reduce and go away. It won't go away completely, but if it helps your eye.
I have a question about Zalatan.
Yes.
I have really dry eyes. So if I put a tear in and wait 20 to 30 minutes and then do the Zalatan, because the Zalatan just seems to burn my eyes.
Right.
It seems like it's almost like a pressure.
Right.
It's not a burning. It almost feels like a pain in my eye.
Yeah.
Does that mean my eyes are too dry before I put the drop in?
Yeah.
So
Yeah, that could be. And so when you put the Zalatan in, just keep your eye closed. It'll burn, but I agree with you with putting a moisture drop in your eye 20 minutes beforehand.
okay.
And like I said, one of those good ones is like Soothe XP. That'll coat it really well, and then use your Zalatan 20 minutes later and see if that helps out. Or store your Zalatan. Try storing that one in the fridge too.
I do.
Yeah.
I use it cold
Okay.
before I go to bed. But like I said, I probably look at the screens too much, my phone, and I get dry eye from looking at it so much.
Yeah. Yeah, you can blame us for doing that because we invented them.
That's funny.
Well, go ahead.
I had another question. I'm glad she brought up about crying because I noticed like the other day I just got some sad news about a friend of mine, and it really made me cry, and her health issue. And I thought, I wonder if crying affects the, the Meibomian glands. Like, does it plug it more or anything like that? Having blepharitis, I wonder, does that affect it, or is it better for it?
It's a good question. Now, the crying is your what we call accessory tear gland. That's up in the corner. It's way under your lid, way up here. Just crying alone won't affect it directly because it's the water part. The meibomian's the oil part. But when you cry, if you're just dabbing, that's going to affect, it's going to affect the quality there if you're flushing out more oils. So the crying directly won't affect the meibomian glands, but rubbing or wiping can have those glands.
Oh, so like, in other words, if you were crying, like when I got the sad news about her, if I wipe my eyes with a tissue pressed on it, that like gets the oil out?
That'll press the oils because the oils are right below the lash line. Right under those lashes is where the oil glands are at.
Because
So
I mean,
wiping there, you're squeezing those oils out too.
even though it's not, you're not heating the eyelid, you're just you're wiping
Right.
it. I mean, it's not like you're saying you're in the shower or you're putting the warm
Right.
water.
It'll still squeeze some of those oils out.
Oh,
just rubbing. Yeah.
I see. I didn't know that. Oh, okay.
Mhm.
But crying doesn't disturb them, basically. Oh,
No.
okay. Okay, thank you.
Okay. Okay. Anything else?
Yeah, I got a question.
Sure.
I know a lot of women lately are getting artificial eyelashes and they put this thing on their eyelid, that type of liquid, and then the eyelashes kind of like stick to that thing that they put onto their lid. I can't imagine it being really great for your eyes to on there. What's your thought about artificial?
Well, mostly they're putting it right on the skin right there, just about that little lash line. So not too bad affecting the oil glands, but that's if they're doing it perfectly. Is any getting down on the lashes, or when they pull it off, is it pulling any of their lashes out? That's another thing.
Like in shops, getting artificial lashes and stuff put on
and yeah.
And it's like I've been so afraid to try anything like that, because same thing with mascara. It's like I try to every 2 to 3 months, I throw it away.
Right.
And get a new one.
Which is a great idea. And saying just because when you're putting it there, every time you touch your lash, any little bugs on that, when you're putting them back in the tube, you're putting it right back in the tube, and that can infect it again.
It's not going to hurt you. Like occasionally I'll put it on and.
Yeah. And no, that's not going to hurt.
Like I'll poke my eye with the wand and I'm like, oh no,
But we've seen that a few times.
Cause problems just if you
and that's well, there's the prescription drop to grow your eyelashes thicker, darker, longer is called Latisse.
Yeah.
And that is actually a very weak glaucoma drop.
Right.
There's Xylitine. So that's how they found out about it, and saying, people that are using the glaucoma drops are getting thicker, darker, longer eyelashes.
Right.
So then they worked out the formula for how weak can we make that drop and still grow the eyelashes without causing any pressure change. And then so they came up with Latisse. But Latisse is about $125 per bottle per month.
Yeah.
To make thicker eyelashes.
When they look at it,
could be $5, $10 a month or whatever, and saying
it's very cheap.
Yeah.
I know. People look at me and say, "Man, your eyelashes are long and thick." I said, "Yeah, well, I take glaucoma drops for it." So So.
Well, I've had women come in and ask me to diagnose them with glaucoma.
No.
I can get that drop. My insurance will pay for it then. I'm sorry, no, I can't.
This has been very interesting. I always love listening to you.
Your questions are excellent.
I think you're very well informed. I'm totally impressed. I mean, you're very
Yeah,
knowledgeable. You
So
have
I have
lots-
the other doctor in my ear and he's telling me all the answers.
Oh.
Uh,
I was
Well,
wondering,
I
could
had
we-
2 more questions, if you don't
Sure.
mind. I was also told that my eyelids, are dropping.
Mhm.
And they said that that's going to continue as I'm getting older, which obviously, if that's happening every single day. I don't know why that's happening. So why is that happening, and what is the solution?
Yeah. Yeah. The number one reason is not because you're getting older, it's because you're becoming more mature. And saying, but that happens. There's around our eye, actually in your eye orbit, it's all fatty tissue around there. And your eye actually sits in the fatty tissue, and that acts as a shock absorber so your eye doesn't pound on the bone. And there's tissue around there that kind of keeps that fatty tissue back. There's also, we have the muscle here, as we become more mature, weakens, and that drops your eyelid down a little bit. And so it's just a normal, we call it aging process. Now, the great news is it's one of the few plastic surgeries that a lot of insurances do pay for. And you can see a specialist, and I'd looked this up. There's 177 of these specialists in the United States. And I think we have like about 8 of them in Southeast Michigan. And there's one group, they're called the oculoplastic and facial surgery specialists. There's a group called with Dr. Nisi and Gladstone. And they're ophthalmologists that specialize in plastics of the face only. And that's all they do, anything facial. I tell people, say, well, I see this plastic surgeon. I said, yeah, they'll do a liposuction on somebody and a breast implant in a tummy tuck over here, and then they'll do your eyelid. And saying, these people, that's all they do is face and eyelids. So that's where we refer to them. Your general ophthalmologist will do your eyelids up to a certain point. But then they say, well, if it's when they cut open, is it the muscle? Is it the we call it little levator, a little aponeurosis that's pulling down, weakening? Is it the fat that's protruding? That's all these people do. And that's they'll see that. You also want to get that eyelid pulled up and tucked up. But if they tuck it too much, then you don't have a blink. Then it keeps the eyelid open. I've had a few of those people with dry eye that they no longer have a complete blink. They can only blink so far because they had too much surgery done. And so these doctors, they can do that, and I refer a lot of people out to them for it, and they're the specialists in doing that, to try to tuck it up and to get it so you can blink a little better.
And what was their name again?
The group, it's headed by Dr. Nisi, Nesi, and a Gladstone, ocular and facial cosmetic surgery, I think.
Okay.
It's a group.
Ocular and facial surgery.
Yeah, ocular and facial, maybe it's ocular and facial plastic cosmetic surgery, something like that. But I'd say
Okay.
if you look up Dr. Nisi, that group, Nesi.
Yes, okay, thank you.
So yeah, whenever I'm writing a letter, I just put it, dear doctors, because I think they have 5 or 6 doctors in the group now. And they have probably 8, 9 offices they go to. So they're not all at every office, but there's different offices. So some of them, sometimes they'll be at one office, maybe 2 times a month. They'll see people with just strictly eyelid problems out of a plastic surgeon's office. So they'll be the specialty with that.
I was wondering if you could repeat, in the beginning, you mentioned 3 or 4 different eye drops you recommended. One
Okay.
was Sustain something.
Sustain Complete.
Oh, okay. And then you said there was a Blink and a couple others, right?
Blink Tears.
Okay.
Another one, Refresh Relieva.
Okay.
Yep, Relieva.
Okay.
What's interesting is they have a Refresh Relieva for contacts, and a Refresh Relieva PF. The only difference between Refresh Relieva and Refresh Relieva for contacts are the words on the box.
Oh, wow.
The solution is exactly the same between the two bottles.
Gee, that's interesting.
Normally, the one for contacts is more expensive, so I said just get the Refresh Reliever and you're fine. The
Yes.
Refresh Reliever for PF is, instead of individual, PF is preservative free.
Oh,
So it's a bottle that has a 1 month dosing supply. So when you squeeze it, it's a weird kind of looking bottle. And when you squeeze it, it gives you a metered dose, but it's sometimes really hard to handle. And I think the metered dose is a little bit too much. So we don't even use that one, just use Refresh Reliever, because the preservative in that one is, we don't have any problems with. One other one I'll mention too is Refresh Mega 3.
oh,
MEGA-3. So it has omega-3 fatty acids in it.
wow.
Oh,
And that one is non-preserved only. And that one's another one that we get some good results with too.
Yeah, that would be. Okay, thank you.
What about TerraTears, Dr. Hodak? I used to use TerraTears before, but I switched to Blink Tears. So
Yeah, Blink and TheraTears. Yeah, what's really interesting about TheraTears, we're having some problems trying to find it, and we don't have a rep. They're not coming in anymore, and it was like people say, well, I'm having problems finding it, and so it was like, so I'm taking that off my list because people are having difficulty trying to get it.
Yeah,
But
I
if
found
you
it.
find it there, go ahead.
I found it at Target.
Oh, okay, Target.
Target.
Yeah, so TheraTears is another good one.
Yeah,
Hmm.
For whatever reason, they don't sample us any TheraTears anymore.
yeah.
thank you so much, Dr. Hodak. It's
You're
been
welcome.
a pleasure. I hope you can come back again to speak to our group.
Sure.
Yeah, it was very good.
Very
Really.
good.
thank you.
Okay.
Thanks again.
Okay. Well, hopefully everybody stays safe and stay healthy.
Yeah, you too.
You
You
too.
say if you can get the vaccine, go ahead and get that vaccine.
Oh, what about people my age group? Did you say we're the last ones, like the ones that are in the 30s and stuff? Because I'll be 37 next month. So.
Yeah. Yeah, you're down the line somewhere.
So, oh, as long as my mom and my sister get it, because my sister's disabled, so she lives at a group home facility. So I
So
think.
they'll be up on the list.
Oh, okay,
Mhm.
cool. All right,
And-
thank you, doctor.
You're welcome.
Thank
Okay.
you.
Thank you.
Thank you.
Okay, well, have a good day. Thank you for
Thank
having me.
you.
Bye-bye.
Yep.
Thank you
Bye-bye.
so much.